What if there was a pill that could slow down your racing heart, protect it from damage, and even save your life? Sounds powerful, right? But here's the catch. This same pill can also bring risks you should never ignore. That pill is Bisoprolol. In this video, we'll break down what it is, how it works, the benefits it can offer, and the dangers you need to watch for. Bisoprolol is a type of medicine known as a beta-1 blocker. Think of it as a shield that calms the heart. It slows your heartbeat, reduces how hard the heart has to work, and lowers the demand for oxygen. Doctors prescribe it to control high blood pressure, ease chest pain caused by angina, and help certain patients with heart failure. In simple terms, Bisoprolol gives the heart a break, helping it stay steady and protected. To understand Bisoprolol, imagine your body when it is under stress. Your heart races, your blood pressure rises, and your body pumps out stress hormones like adrenaline. This reaction is helpful in emergencies but harmful when it happens all the time. Constant stress on the heart makes it weaker, raises blood pressure, and increases the risk of heart attack or stroke. Here's where Bisoprolol steps in. It blocks the beta-1 receptors in your heart. These receptors normally receive signals from stress hormones that tell the heart to beat faster and harder. By blocking those signals, Bisoprolol slows the heart down. Your heartbeat becomes steadier, the pressure in your blood vessels drops, and the heart uses less oxygen. There's another effect too. Bisoprolol lowers the release of a kidney hormone called renin, which also raises blood pressure. So the drug helps on two fronts. It calms the heart and reduces the pressure in the blood vessels. In short, Bisoprolol is like a shield for the heart. It protects against the harmful effects of stress hormones, lowers blood pressure, and makes it easier for the heart to do its work. This mechanism explains why it's trusted in treating heart conditions worldwide. The biggest benefit of Bisoprolol is its ability to control high blood pressure. High blood pressure is called the silent killer because it often shows no symptoms but slowly damages the heart, brain, and kidneys. By lowering blood pressure, Bisoprolol reduces the risk of heart attack, a stroke, and long-term heart disease. Another important benefit is that it reduces chest pain, also known as angina. Chest pain happens when the heart does not get enough oxygen. Because the Bisoprolol slows the heartbeat and reduces oxygen demand, it can ease this pain and prevent dangerous heart stress during activity. For patients with certain types of heart failure, Bisoprolol is a lifesaver. It helps the heart pump more effectively over time, reduce hospital visits, and even lowers the risk of death in stable patients. There is also an advantage compared to older beta blockers. Bisoprolol is more heart selective, meaning it mainly affects the heart and less often causes breathing problems or sexual side effects. In short, Bisoprolol gives the heart a much-needed rest. It helps control blood pressure, reduces chest pain, and supports weak hearts. For many patients, these benefits are the reason they can live longer and healthier lives. Like every medicine, Bisoprolol comes with side effects. Most are mild, but they can still affect daily life. One of the most common is tiredness. Because the drug slows your heart, some people feel low energy, especially in the first few weeks. This usually improves as the body adjusts. Dizziness is another frequent complaint. Since Bisoprolol lowers blood pressure, standing up quickly may cause lightheadedness or a spinning feeling. Some patients also experience headaches, nausea, or diarrhea, which tend to be short-term. Cold hands and feet are also common. With a slower heartbeat, less warm blood reaches the outer parts of the body, making them feel chilly. Muscle weakness or mild stomach problems can occur as well. For many people, these side effects are temporary and not dangerous. Doctors often recommend starting with a low dose and increasing slowly. This helps the body get used to the medicine. The important point to remember is that mild side effects should be watched, but they don't always mean you need to stop the drug. In most cases, they can be managed and may fade over time. Still, if symptoms become bothersome, it's best to talk with your doctor. While many people only face mild side effects, bisoprolol can sometimes cause serious problems that should never be ignored. The biggest risk is every slow heartbeat, also called bradycardia. If your pulse drops too low, you may feel dizzy, faint, or unusually weak. In severe cases, this can become life-threatening. Another danger is shortness of breath or swelling in the legs and ankles. These may be signs of worsening heart failure or fluid buildup in the body. Some patients also report chest pain or sudden weight gain, which must be checked immediately. For people with diabetes, there is an extra risk. Bisoprolol can hide the warning signs of low blood sugar, such as a racing heartbeat. This makes it harder to recognize when blood sugar drops too low. Allergic reactions, though rare, can also happen. Look out for rash, itching, swelling of the face, or difficulty breathing. These need urgent medical care. Another critical danger is stopping bisoprolol suddenly. Doing so can cause blood pressure to rise quickly or trigger chest pain and even heart attacks. Doctors always recommend reducing the dose slowly. In short, never ignore chest pain, severe fatigue, or breathing issues while on bisoprolol. These are red flags that need fast medical attention. Bisoprolol is powerful and helpful for many people, but it is not safe for everyone. Some conditions make the drug riskier, so caution is needed. People with asthma or chronic lung disease should be very careful. Although bisoprolol mainly targets the heart, in higher doses it may still affect the lungs and cause breathing problems. That's why doctors often avoid it in severe asthma cases. Those with very slow heart rhythms, a condition called heart block or extremely low blood pressure, should usually not take bisoprolol. For them, slowing the heart further could be dangerous. Patients with circulation problems, such as severe Raynaud's disease, may notice colder hands and feet because the drug reduces blood flow to the extremities. Caution is also advised in people with liver or kidney disease, since these organs help process the medicine. Doctors may need to adjust the dose to avoid complications. For diabetic patients, special care is needed. Bisoprolol can hide some signs of low blood sugar, making it harder to notice when sugar drops too far. In short, bisoprolol is not a one-size-fits-all drug. A full medical history and close monitoring are essential before starting treatment. For many years, bisoprolol and other beta blockers have been the standard treatment for people after a heart attack and for those with heart disease. Doctors prescribe them almost automatically. But new research is starting to question whether this approach is always necessary. Recent large studies suggest that not every patient benefits equally. For example, people who survive a heart attack but have a normal heart pumping function may not gain much from long-term use of beta blockers like bisoprolol. In fact, some research shows that in these patients, the drug might not lower the risk of death as much as once believed. However, for patients with heart failure or those whose heart function is reduced, bisoprolol continues to show strong benefits. It helps improve survival, lowers hospital visits, and makes the heart work more efficiently over time. Another area of research is looking at how beta blockers interact with other modern heart drugs. With newer treatments available today, some experts believe the role of bisoprolol may need to be redefined. The bottom line is this: bisoprolol remains a trusted medicine, but scientists are learning that it may not be equally useful for everyone. Personalized treatment is becoming more important. Bisoprolol is a medicine with two clear sides. On one hand, it brings powerful benefits, lowering blood pressure, easing chest pain, and protecting weak hearts. For many patients, it truly improves both quality of life and survival. On the other hand, it carries risks that cannot be ignored, such as slow heartbeat, breathing issues, and hidden warning signs in people with diabetes. The most important rule with bisoprolol is never stop it suddenly. Always follow your doctor's instructions, and if side effects worry you, discuss them before making any changes. A slow adjustment under medical guidance keeps you safe. Remember, every patient is different. What works well for one person may not be the best choice for another. That is why doctors check your health history, monitor your heart, and sometimes adjust the dose until it suits you. In the end, bisoprolol is not just a pill, it's a tool. In the right hands and for the right patient, it can be life-saving. But it demands respect and careful use. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health insights. Stay informed and take care of your heart.